Okay, thank you. Okay, good evening, everyone. We will call the meeting of the DuPage County Board of Health of September 10th, 2020 to order. And Penny, would you please call the roll?
Ms. Bottoms?
Here.
Ms. Finch?
Here.
Dr. Hussein?
Here.
Mr. Larson?
Here.
Dr. Munir? Dr. Scouten?
Here.
Mr. Spadoni?
Here.
President Tornatore?
Here.
Dr. Weeks?
Here.
And Dr. Wilson?
Here.
Mr. President, you do have a quorum.
Thank you. And thank you all for joining us. We'll move on to the item of public comment. Do we have any public comment this evening, Penny?
Yes, we have two public comments that I'll read into the minutes.
Okay.
First
do.
one is from a Heidi Foley. DuPage County is in the same region as Kane County, yet the guidelines for schools opening are much stricter in DuPage County. Kane County has been able to successfully open in hybrid models. If we are in the same region, why are our directives different? Our children's mental state is being severely affected by not having in-person schooling. Why isn't mental health playing a bigger role in the development of these guidelines with this low-risk demographic? The other is from a Jim Barnett. I am a parent of two Wheaton Warrenville South High School students. What is the holdup on opening our schools? I have talked to the DuPage Health Department and our Board of Education, and both are finger pointing as to why we are not open when schools across the state, including Kane County. With York High School set to return to begin hybrid in-person learning next week, it is time for someone to stand up and get our kids back to school. Our district voted 80% for hybrid learning. Listen to the people you represent. And that's the conclusion of the public comments.
Okay, thank you. And thank you to those people who have taken the opportunity to comment to us.
Sam,
We always listen.
Sam, could I just interrupt for a moment?
Sure.
Could I just clarify that we are meeting pursuant to 120/70? So we read that into the record last time, but I just want to be clear because we don't have anybody at the health department that's still closed to general public, which is why we're still meeting.
We did. Thank you, Lisa. I know we did read it in last time, and for whatever reason, I don't have it in my notes to do it this time, but I thank you very much for,
Sorry, I didn't mean to interrupt.
no, it's not an interruption. It's putting us into compliance, which is great. Okay, thank you. Under President's remarks, I have a couple of things. Once again, welcome to not quite the beginning of fall, but it feels more like winter right now, but it's hard to believe that summer is just about over. We have a number of things to talk about tonight, including the presentation by staff of the 2021 budget request, as well as further information on COVID and our opportunities to celebrate the investment of one of our employees' employment anniversary. Also, Karen, our executive director, recently participated in a small group of regional health and public health leaders with the White House Senior Advisor, Dr. Deborah Birx, on September 1st. She was visiting Chicago to deal with the ongoing concerns about the Illinois' increases in cases in the virus and how it's growing more quickly in the rural areas of the state. It's my understanding that she did caution, that is, Dr. Birx did caution all of us as Illinois as a whole, that we're in a critical time, and encouraged our participants to continue to address the pandemic with science, facts, and available resources. We will be having a full slate, hopefully, of Board of Health members at the next board meeting. There will be a new member appointed at the next meeting of the county board. It's Chairman Cronin's nominee, and she will be with us at the next meeting. There will be an organizational orientation with some senior staff and myself with her before the next meeting to kind of bring her up to speed. We look forward to having her in. Before I get to the recognition regarding Militia Kroll, I did want to throw a bouquet to member Bob Larson and also DuPage County Board member Ashley Sullivan, who collaboratively worked on with the health department as well as the DuPage Health Coalition to establish, if you will, a voucher system for flu vaccines this fall for those underinsured and uninsured people through Access DuPage and the DuPage County Health Coalition. There's approximately $300 that was being utilized through the CARES money that was allocated.
300,000.
And I'm sorry, it's,
You said 300,000.
300,000, I'm sorry, $300,000, yes. And with the DuPage County Health Coalition and Karen's and Bob and Ashley's ability to facilitate that, we're going to be able to give those people who are uninsured and underinsured an opportunity to get a flu vaccine, which is terribly important given where we're at with COVID. And I also understand from Karen that Walgreens has even anteed up and will be issuing additional vouchers if necessary, if we run out with the money that's been allocated. So thank you to Bob. Thank you to the DuPage County Health Coalition, to Ashley Sullivan from the DuPage County Board, to Karen, and all those who have made this happen for those people who will need it come this fall, right now. It's my pleasure at this point to read an employee recognition for Melissa Kroll. I don't know if she is on, but if she's not, she's going to get, we're going to read this into the record in any event. This is a resolution of commendation for Melissa Kroll, Behavioral Health Services. Whereas Melissa Kroll has dutifully served the DuPage County Health Department for over 29 years, most recently in the position of an emergency services counselor. And whereas Melissa Kroll spent her first 16 years working at the Intensive Outreach Unit in West Chicago Public Health Center, serving the child and adolescent outpatient population through the provision of intensive community-based services. And whereas Melissa Kroll is recognized within the health department as having considerable adult crisis, child and adolescent, and MISAP, mental illness, substance abuse expertise, with the emphasis on cultivating hope within the clients served in the behavioral health programs in DuPage County. And whereas Melissa Kroll was instrumental in providing crisis assessments, individual therapy, family therapy, and case management services to the residents of our communities. And whereas Melissa Kroll has modeled calm and caring interactions for her peers in the midst of intense crisis experiences. And whereas Melissa Kroll has repeatedly demonstrated a strong commitment to the high-risk population served in behavioral health in DuPage County with courtesy, understanding, patience, and taking extra time and effort to ensure safety, care, and support of individuals and families during mental health crisis episodes. And now therefore be it resolved that Melissa Kroll, through her dedication to the DuPage County Health Department as an emergency services counselor and her advocacy for behavioral health services, has served an important role in fulfilling the mission and values of the DuPage County Health Department. And be it further resolved that I, Sam Tornatore, Board of Health President, and the members of the Board of Health to hereby congratulate and thank Melissa Kroll on her contributions to the DuPage County Health Department and the residents of DuPage County. Approve this 10th day of September 2020. I'll entertain a motion to approve this recommendation.
So moved.
Is there a second?
Second.
All those in favor signify by saying aye.
Aye.
Congratulations to Melissa. I don't know if you're on. If you are, congratulations. If you're not, congratulations, and hopefully you will be made aware of this the next time somebody gets a chance to see you, and hopefully it'll be us. So thank you all thank you very much, Melissa, for all you've done for us and continue to do. Moving on, we will go on to the public health updates. We're going to have our budget presentation and our community COVID-19 update. We'll start with the budget presentation. And Karen, I don't know if you're going to begin it or if we go right to Mike.
I am going to begin it, and I believe, Adam, you're going to be driving. Correct? Okay, well, it seems incredible to believe that it is that time of the year again to present you with our budget. The issue of COVID-19 flavors is infused in both this current year's budget as well as next year's budget proposal. As we always do, we have a theme for this budget, and we used the opportunity for a little bit of a play on words, taking cares of business. That is taken from the CARES Act. For those of you who are not aware, the Coronavirus Aid, Relief, and Economic Security Act was passed with unanimous and bipartisan support and signed by President Trump on March 27th of 2020. And so that kind of frames our budget presentation for this evening. Next slide, please. We certainly cannot talk about our budget in terms that exclude COVID, because our budget this upcoming year, like the budgets previous to this year, provide us with a framework for delivering services in the most effective and efficient manner possible. It's more than a checkbook. It's more than an accounting spreadsheet. It really helps drive where we're going to prioritize our resources to serve the residents of DuPage. So we'll talk a little bit about that. We'll revisit our digital transformation and strengthening our workforce discussion that we started earlier this year at the Board of Health retreat. We'll look at the continuity of operations and where we're at currently with our organizational capacity and programming. And then we'll move into the dollars and cents of our budget. Mike will provide a high-level summary of our 2021 budget proposal. You will all be receiving via mail your budget books. They'll be mailed out tomorrow, and so you'll receive them early next week. And finally, we'll look at the budget impacts and forces of budget pressure, both positive and negative, as we move forward. Now, as a reminder, once you receive your budget books, we'll allow you a couple of weeks to review the detailed budget information that's included. Mike will then reach out to you individually to address any questions or concerns that you may have so that you are ready for the vote next month. We will vote on the budget at our October meeting, at which time it will be sent to the county board with a request for our full levy amount. It has not yet been scheduled, but presuming that this year, like all others, either in October or November, I will provide an overview to the county board, and ultimately the county board will approve our budget as well as our levy request upon the approval of their 2021 budget. So with that, let's move into COVID updates. And I'm going to, next slide, please. I'm going to spend just very little time talking about current trends. We'll talk a little bit about school activity and some of the other opportunities that we have had in our response over the last month. We have historically provided an in-depth written summary. However, tonight I want to just kind of showcase or highlight some of these initiatives. First off, our current trends, and Dr. Chu will go into much more detail during her presentation, but let me suffice and bottom line the direction of our metrics with COVID. And our metrics are absolutely going in the wrong direction when it comes to the spread of the virus within our community, as well as we have had a slight uptick in deaths to our county residents. And again, Rashmi will talk more about that with you. We have surpassed, as of September 3rd, we have surpassed 20,000 tests provided at our community-based testing site. We currently have 59 additional staff hired on a temporary basis to assist us with that effort. In addition, we have over, and this is as of late August, we have over 13,000 confirmed cases that have been investigated through our communicable disease and contact tracing team. We have trained 70 of our existing staff and have hired 110 temporary employees to assist in maintaining those efforts. We have continued to work with schools and have regular standing meetings with superintendents twice a week on Mondays and Fridays. We have provided daily emails and correspondence to them with any updates that are coming from the state. Our educational response team is working around the clock, and it is staffed with not only members of our current staff, but we were able to add a nurse to help support that team through our CDC Foundation grant dollars. We have issued a framework based on a superintendent's request that is rooted in both IDPH and ISB guidance. This guidance was provided by drawing on information from across the country. And we are issuing updated weekly measures, and Rashmi will point that out on our website, on our dashboard on a weekly basis. When we look at mass vaccination, clearly you've heard and seen in the news about readying for the vaccines in the next couple months. We are in routine contact and communication with IDPH and are preparing our local efforts accordingly. We anticipate a more comprehensive information and plan to be released from the state of Illinois next week. And our planning efforts will be able to rapidly accelerate once this information is obtained. We do anticipate, in addition to responding to the pandemic itself, we anticipate many other challenges associated with the mass vaccination efforts, including vaccine hesitancy, concerns around safety, and public education, in addition to simply the logistical and operational delivery challenges. When we move into the next phase, or the next section of this presentation, talk about digital transformation and strengthening the workforce. Next slide, please. What seems like a lifetime ago, earlier this year, however, we dedicated our annual Board of Health retreat to these two priorities: digital transformation and strengthening the workforce. At that point, we discussed and engaged your interest from the Board of Health perspective on investing in both digital transformation elements, including the allowing of remote work, telehealth, and the like, as well as maintaining our high quality and flexible professional workforce. Next slide, please. Now, COVID allowed us an opportunity. I like to talk about challenges in terms of opportunities to accelerate in reality, warp speed on both issues beyond anything we could have imagined. The needs for remote work were realized overnight, and our amazing IT department was able to not only equip us at that moment, but they've sustained and increased our efforts. Our workforce needs shifted dramatically, and we suddenly needed to redeploy existing staff, hire new workers for evolving responsibilities, and then reevaluate the need for both the short and long-term needs of our workforce. We have leveraged CARES Act dollars to invest more into telehealth. These investments have most importantly allowed us to maintain critical services for vital needs to our community residents, such as nutrition, food assistance, mental health services, substance use disorder treatment. But further, this investment assisted in maintaining our ability to generate revenue during the past 8 months. All told, we have invested approximately $547,000 in our IT infrastructure. Next slide, please. So let's talk a little bit about the continuity of business and services. Next slide. We maintain the majority of our direct service delivery programs throughout this pandemic. We had a brief time that we suspended some services initially. Those services include services provided to the jail. We provided only very urgent dental services. Our environmental health inspections were suspended. For a time, our immunization, STD clinic, and our breast and cervical cancer screening program was suspended, as was our hearing and vision program. Hearing and vision program takes hearing and vision techs and deploys them into early childhood, preschools, kindergartens, and they, I am very happy to say, are the only program that still is not back as is their routine. Otherwise, all of these other services that I listed off, in addition to community health work benefiting, family health programs, outpatient substance use disorder treatment, mental health crisis and psychiatry services, Narcan distribution, intake and referral, as well as our back of the house activities, IT, accounting, human resources, and our amazing health promotion staff have all been fully operational during this period of time. Next slide, please. As Mike indicated, the contingency budget that we had set up in the 2020 budget, or the contingency allocation, allowed us the opportunity to respond immediately to the emerging COVID needs. And a flexible workforce allowed us to reposition staff to meet the evolving service delivery needs and/or fulfill our emergency response roles. Now, when I say flexible, I think this has been and will continue to be one of the elements that really has led to the effective response we have been able to achieve so far to this pandemic. And it didn't just start with COVID. It actually dates back to our efforts probably 15 years ago, from moving staff thinking of themselves as specialists to more generalists. And it also really has occurred as we've changed culture over time. That although your day job, or you may have been hired to be a dental hygienist or an environmental health specialist, a prenatal health nurse, a front desk staff, or a billing analyst, we are all part of the public health workforce. And to achieve this cultural shift, I think it's really very important, and I'd like to pause just for a minute, that we can only change culture by really having leaders who both demonstrate and support this kind of effort. And so I would like to just use this opportunity to thank the very talented leadership team that we have at the DuPage Health Department. And really thank you for the ongoing efforts, because I know, I look at Andrea and think in terms of her awareness of now many facilities related issues, or Lori's background in mental health, and now she is administratively responsible for running the community-based testing site. And Chris, who started out with community health education and now has turned into our incident commander extraordinaire, and I could just go on, and I feel bad that I'm not giving everyone enough credit, but our ability to manage and navigate this past 8 months is in large part because of your efforts. So thank you once again. In terms of our direct staff, nearly 70% of all 558 staff at the DuPage County Health Department have been activated and participated in some form, fashion of our COVID pandemic response. And equally, or if not more impressive, is the fact that many of those 376 employees have done both. They've maintained their ongoing responsibilities, may have scaled them back, but they have also assumed some of the COVID response activities. So it is with that context, culture, and backdrop of our 2020 efforts that I'll now turn it over to Mike to set the stage for 2021. Mike?
Thank you, Karen. Good evening, Board of Health. Budget development for us, as I've mentioned in the past, is really a year-round process. We started assembling the 2021 budget detail in June. We had several meetings with directors and Executive Director Ayala, talking through cost centers and line items, et cetera. So it is definitely a year-round process. And Karen also mentioned that after tonight's meeting, we'll be mailing the books out. Those books will have department level, categorical, and line item detail. They'll also have service unit level, service unit categorical and line item detail, and also cost center line item detail. In addition, at the back end of the books, you will find the budget supplement that provides you with year-end budget and actuals for years 2017 through 2019, actuals as of July 31st this year, and a straight line projection for year-end 2020 as well for this year, and then proposed budget amounts for 2021. In addition, I will be calling each one of you or reaching out to each one of you between now and the October meeting to make sure that you have everything that you need for the vote and that all your questions are answered. Next slide, please. FY 2021 budget assumptions. On the revenue side, as always, projections are based on trends, conservative estimates, and known contract awards. Property tax levy remains at 18.4 million, which is what it was last year when the health department followed the county lead to increase the tax levy. We went from 17.9 to 18.4. That was the first increase in the health department levy since 2003. CPI escalator that's allowable in the county ordinance will allow us to raise the environmental health fees by 1.5%. That's the estimate at this point in time. Investment earnings are reflective of the current market. And as we always do, we will pursue all revenue opportunities that support DuPage County Health Department mission, vision, and values. On the expenditure side, the expenditure budget includes a 3% pool for merit-based increases. The employer IMRF rate has decreased slightly, going from 12.07% to 11.94%. The health department insurance costs are expected to increase by 8%. That's the same assumption used by the county. And then, as always, we'll continuously examine service delivery and business processes to search for improved effectiveness and efficiencies. And as it's obvious, COVID-19 response efforts are likely to remain a major focus in 2021. Next slide, please. Budget assumptions, COVID-19 impact. There was a couple of obvious ones. One is that we expect that the COVID impact will definitely increase our demand for services. We also expect that it'll present additional budget pressures for local, state, and federal governments. We accept or expect increases in the demand for our services due to new variables affecting the demand for services, such as additional barriers for those suffering from mental health and substance use disorders, and additional pressures to vulnerable populations such as adolescents and seniors. And not that health equity is a new issue, but the pandemic has certainly magnified the need to address this, as it will become a top priority moving forward. In terms of pressures on state, local, and federal governments, the pressures would be from expectation of reduced revenue from traditional sources, taxes, sales tax, income tax, property taxes, potential costs of federal government for an additional stimulus bill. I understand that didn't pass the Senate today, but we would expect at some point, probably post-November, some stimulus package to be adopted. Now that will be a federal budget pressure, but it should certainly help support state and local efforts in terms of dealing with the COVID response. It's also an impact to the local economy, reduced spending, business closures, et cetera. There's also a likelihood of reduced funding to our community partners and non-for-profits. All these things add up to much harder choices on where to allocate available funding for state, local, and federal government. Next slide, please. Budget highlights. Next slide. Some high-level highlights of our 2021 budget. The operating budget is balanced at just over 51 million. When I say it's balanced. If we pull out the grant apps lines and the infrastructure fund lines, it's balanced at 51 point, and COVID operations we're at about 51.1 million. The fund balance is also once again going to need to be utilized this year to balance the budget. We used $500,000 last year, and we discussed the very likelihood that we would need to use fund balance again this year and probably next year. This all really stems from the primary driver of this is the transition of psychological services back in 2019 from the county to the DuPage, to us, the health department. Originally, this was about $1 million budget hole that has been reduced to $750,000 in our 2021 budget, with further reductions expected in the next couple of years. Our cash reserves remain healthy and will be needed as the department is prepared to embark on an organizational assessment in 2021 to ensure that all programs are sustainable. This budget will also include the budget reserve, the $500,000 that we allocated last year in the 2020 budget will again be allocated in the 2021 budget. And the increase in grant applications, we're looking to go from $3 million, which was typically enough for us to accept any unforeseen grant opportunities or increases to grant awards. We found out this year with COVID funding being what it is, that we needed to increase that. We think $50 million should be sufficient. We will continue to utilize the infrastructure fund for capital procurements and strategic initiatives. Any spending in that fund will again have to go back to the Board of Health for approval. And again, mentioned that the overall increase, excluding COVID operations, grant applications, and the infrastructure fund is about almost 1.2 million or 2.4%. Next slide, please. Budget highlights COVID operations. As we've mentioned, we've set up several cost centers to track financial activity for COVID funding that we've received. The largest source of COVID funding to date has been the $16.5 million allocation made by the county board back a few months ago. We have spent a portion of that, and we have several ongoing initiatives to spend the rest of those dollars. These funds have to be spent by December 30th. So what we've done is we've taken 25% of that $16.5 million, expecting to spend that in the month of December. And the list on this slide and the dollar amounts show how that 4.1 million has been allocated in the 2021 budget. We also have funding from IDPH for a case investigation and contact tracing grant. This is about 50% of that award. And then additional funding from DuPage County WorkNet DuPage for contact tracing as well. Overall, we have just under $7 million in the 2021 budget in balanced revenue and expenditure lines. Next slide, please. This table compares the 2021 proposed budget to the 2020 original budget by major revenue and expenditure category. If you see it, look at the bottom line, you see the 2021 budget reflects a 103% increase, or 55 million compared to 2020. Obviously, the most significant portion of that increase comes from the two sources I've mentioned. One is grant applications. We have a $47 million increase, and the other is from COVID operations, $6.8 million. The 2021 budget also includes some added funding for personnel in CDEPI and IT, as these areas will certainly be asked to do more moving forward. Next slide, please. This gives you a really a better look at where the 2021 budget looks compared to 2020. We've excluded the COVID operations and the grant applications funding. This gives you almost $1.2 million increase by category. Now, on the revenue side, new grants from the United States Department of Justice, the Support Court Services, and the County Correctional Center with mental health and opioid intervention programming, along with some increases to our DHS crisis and residential awards, are the primary source for the overall increase. On the expenditure side, the 3% merit pool and personnel costs and an increase in IT services related to telehealth and telecommunicating costs, in addition to an increase in expected unemployment insurance, are the primary drivers in the overall increase. And with that, I turn it back to Karen.
Karen, can I ask a question? This is Lori.
Absolutely.
So the CARES Act funding has to be spent by December 30th, but there's nothing magical about that date. The pandemic will still be with us on the 31st. How do you fund and pay for the ongoing operations after that date?
So as usual, a very astute question. Much of the investment that we are making with the CARES Act dollars has to do with support of our staffing resources versus the actual staffing resources. Much of the addition of our community-based testing staff, that will be winding down as of October, the end of October, because of weather concerns, not because of the end of COVID. We're looking at transitioning from a community-based testing site to establishing mobile test groups, but we don't think that we will have the capacity to be doing the 6,000 tests or 600 tests a day like we currently are doing. So that funding will shift. Another element are case investigation and contact tracing funding. We actually are receiving funds through the state, although not sufficient. We're augmenting those with some CARES Act dollars, but those will continue through the state fiscal year next year. We have additional resources that we're applying for, whether that be through the CDC Foundation or there's another foundation. Lori and I were fortunate enough to be fellows with the Kresge philanthropic organization a couple of years ago. They've opened up funding for some of this. So the short answer is we're doing as much investing as we can right now to help minimize and mitigate the impact of COVID. But we do we very much will be needing to keep a robust response going. We very much will be looking for additional dollars through either probably federal sources that then come down through the state to the local.
Okay. So, and I hate to, if you don't mind, if I could ask one more question. So if the community-based testing site is going to be closing, that was actually one of my questions, is about the weather.
Mhm.
How are we going to maintain, as a county, as a state, our level of testing up to this, thousands of tests a day in the inclement weather? Is there a state's position on this?
I don't believe so. We're in the process of developing our county-wide testing strategy because, yeah, your concern is absolutely right. There's no way that we're going to be able to be mucking through snow and ice at the fairgrounds or having windows down and that kind of thing at the fairgrounds. But between both our mobile testing efforts as well as our exploration, particularly with the schools, to do some additional saliva testing that we have not been able to do yet. We feel like we will be able to maintain the level of surveillance. Well, we hope to be able to maintain the level of surveillance that's warranted.
Okay, thank you.
Mhm. Any other questions? So as we look to the future, we know that, and really to your point, Lori, we know that we're, to use an analogy that's timely, next slide, please. We're about in the first quarter. We've about ended the first quarter of, if we consider this to be a strategy that's going to span over 2 years. We have just completed the first quarter of this effort. We will need to continue to address coronavirus pandemic, according to some of the global experts, for at least the next 2 years. And we absolutely are committed to the notion that sustainably strengthening our workforce amidst this global pandemic is essential. But and next slide, as we look at the 2021, some of the issues that we are going to be addressing locally are, not only are we going to be looking at the COVID response, but we also will be taking advantage of the $5 million earmark that Representative Conroy secured for the Central Receiving Center. We heard from Chip last month that there were efforts underway to get that funding released as soon as possible. However, even without that funding, we feel like, and the writing is on the wall, that mental health, substance use disorder needs are going to be surging, not diminishing. So we want to make sure that we have not only our plans in place to redesign and renovate the Central Receiving Center, but then we have a robust and sustainable way of operationalizing those services. We also are going to need to conduct a comprehensive organization-wide review of operations and develop a multi-year business plan. Next slide, please. Next and final slide for those of you keeping score. We understand that there is a high degree of uncertainty on the horizon, particularly regarding the domino effect and the impacts of the COVID pandemic, and as well as our response to the COVID pandemic. As I mentioned, we know that mental health substance use crisis will follow. We know that state and local governments are going to be experiencing record deficits. We understand that the financial impact on not-for-profits will result in a reduction of their ability to provide those services. They're essential partners in our safety net and our public health system. Some of those not-for-profits may not survive. At the same time, will be an increased need for social services. Although we're not exactly sure what the impact is going to be on our local economies, I'm hard pressed to believe that there will be much upside to the local economy as we've seen our sales tax revenue as well as other economic indicators really take a dive. We also know that the strain on low-income families and on families that were marginally surviving will be increased. So we know that we have more to do. We will have more demand for our core services, such as WIC, family case management, and dental services. And finally, but very importantly, we understand that the health equity issues that really have been exacerbated under COVID-19, that really they have always existed, but we see them more and more clearly with COVID, will inform our work and our need to address health disparities and make that an important part of our agenda and our priorities moving forward as it ever has been. So that is going to be, those are going to be the contexts by which we will be developing our business plan for the next 3 to 5 years. In all sincerity, it was one of the things that we were going to work on this year until we got swept away in the COVID pandemic response. But we absolutely must do that as we progress through 2021. And with that, I'll open it up for any additional questions.
Any
Karen, I have
member of
one
the board
question.
have questions of Karen?
I do. Karen, we don't know for sure what the needs will be into the future, but if we speak of infrastructure as bricks and mortar and personnel, do we have the infrastructure to meet future needs?
I would say currently we do. The sustainability, and kind of to Lori's point, the CARES Act dollars and the county's approach in addressing and really prioritizing public health support with those CARES Act dollars have been phenomenally helpful. Once those CARES Act dollars go away, in the absence of those, and with the combined impact on state budget revenues being negative, I think we're looking at some very austere times.
This is Lanny. Board Member Larson had suggested that maybe the federal government might extend the time that we can use those monies. Bob, or maybe Karen, I'm not sure who would know the answer. Any chance that may be coming to pass?
I can jump in and talk about it a little bit. We've been waiting on that for months and haven't really gotten any updates. As you probably heard today, there was a long-term working effort between both houses of Congress that fell through. It's looking more and more like there's not going to be time to get something done before the end of the congressional term, although Speaker Pelosi has said she's still committed to doing something. So we've heard everything from extending the time frame to use the CARES Act dollars. We've already been allocated to additional funds to support loss of revenue for various local governmental agencies. And right now, I'm not super confident of either of those things happening. So just as we talked about earlier, and Lori asked about how we make that decision, where we spend the money and how we do it before the end of the year, we're playing out that same scenario at the county. We're doing it with the support of, when we support the municipalities and the fire protection districts and everybody, we're saying, look, you need to do this in a way that complies with the CARES Act and assume you're not going to get that extension, because we can't guarantee it. And the last thing we want to do is hand back a big check for most of that money when we know we have the needs there. I'm not being reckless in how I spend taxpayer dollars. I recognize they're all taxpayer dollars, but we clearly have the needs here, and we've been pretty innovative in how we do it. So it's good that we have this plan to spend it out, the money that's been allocated to the health department through the end of the year, and we expect to spend everything we have at the county as well. We can make adjustments on that schedule if that changes, but I haven't heard anything definitive from anybody in Congress, from our lobbyists or anybody giving us a good, true indication of a change.
Okay. Thank you, Bob.
Any other questions of Karen or Mike regarding the budget or our future? Okay, just a couple of comments. Thank you, Karen. Thank you, Mike. As Bob has said, there's been a very heavy lift at the county with Bob as finance chairman in particular to work with all of the hands that have been out there asking for a portion of the CARES Act money. I think the health department has been allocated a lion's share of that. The municipalities got $43 million allocated to all of the municipalities in the county, although they have not received that yet. But of course, as you can imagine, everybody is looking for something, but we've looked toward public health and public safety is a priority. In terms of the communication that Karen had indicated earlier, every Monday, you may not know this, but every Monday, Karen and Rashmi and Chris are on a conference call with all of the mayors and managers through DuPage County. I'm usually on that call as well, listening, informing the mayors of what the most recent events are regarding health and COVID, answering a myriad of questions that they may have, from when can we open pools in January to when can we send our kids back to school now. So that's terribly important. And I think back, as you said, Karen, back to the retreat, which was January or February.
February.
February, when we talked about how we were going to retool our workforce and retool our infrastructure and deal with electronics and technical things that we hadn't really been up. And then a month later, we implemented those. I mean, it's a good thing that we had that plan in place. So it's a credit to our staff and to you that we're there. Lori, you're right. There's nothing magical about December 30th, except that's the date that the government said we had to spend the money. And we're using it as best we can, judiciously, trying to get everybody something, with the hopes that if we don't get an extension on that at least there will be that foundation in place to be able to continue on in 2021 with some other funding sources. So kudos to Karen, to Mike. Thank you for keeping the budget in line. Karen, this is going to go to the county board, I would presume sometime within the next month.
Yes.
You're gonna make your presentation? Okay.
Yes.
Okay. Any other questions or comments of Karen, Mike, or anything that we've discussed? Okay, well, thank you for that. We'll move on to the approval of the minutes. I'll entertain
If
a
we
motion
could,
to,
Sorry, Sam, to interrupt. Could
Sure,
we just, because we have a guest who's joining us specifically for this next presentation, Bob, I'm sure, is on the dashboard. Could we have Rashmi walk us through just for a few minutes the COVID dashboard?
of course.
Okay, Adam, you're driving again.
Yes, and thank you. Good evening, everyone. And while Adam's bringing that up, thanks, Adam. I'll just start with the lay of the land at the national, state, and local level. In the United States, we're approaching 6.4 million cases. We're at 6,394,655 cases, and that's including 191,702 deaths related to COVID-19 infection. In Illinois, we recently surpassed 250,000 cases. We're actually at 255,643 cases, including 8,242 deaths, with a recovery rate of 96%. And then in DuPage County, we are, as of today, at 15,682 cases, and that's including 540 deaths related to COVID-19 infection. And we are at very close to the state's recovery rate. We in DuPage County are experiencing a recovery rate of 95.3%. And then just to give a quick overview, you've all seen the dashboard before, but just to start with our new cases over time, just to provide a situational update here. So you'll see here, we were all remember that really high level of activity, March, April, and May, and it came down quite nicely in June. But then with the phase 4 reopening in July 4th holiday, we've seen a gradual rise. As Karen mentioned, we're going in the wrong direction here very clearly. And the concern is now that we're, it's sustained at a high level and we don't want it to go any higher. So we really have our work cut out for ourselves to be practicing, the 3 W's: wear a mask, watch your distance, wash your hands frequently, and really to avoid large gatherings, especially indoors. And Adam, if we could please go to the 4th tab. Our positivity data that we've been receiving from the state was just restored. We actually had gone a few weeks without, they were having some challenges, which they've now resolved. So you'll see here that our positivity rate is concerningly creeping up. We were for a long time hovering around 3 or 4%, and now we have exceeded 5%. So that is also of concern, and that's with increased testing capacity over time. So that's another measure that we're tracking very closely. And this is from our raw data that the state runs from our cases and then provides back to us twice a week. And then Adam, if we could please move to the right lower corner with our severe outcomes. Thank you. So looking at our, hospitalizations by admission date. So again, we all remember that really severe time of increased activity in the spring, and then it's come down, but and we acknowledge the reporting lag because sometimes a week or two can go by before we will actually see the rise. But so this reflects an ongoing low level of activity, but not zero. And our goal is to get to zero. And that can only happen if we reduce our overall community level of transmission, which is, as we said, going in the wrong direction. And so our hospitalizations and our deaths need to go lower. And unfortunately, actually in our daily hospital reports that we get from our health systems, we're just in the last couple days seeing an uptick. So that's of concern. And then, if we could please move to the deaths by date deceased. Again, overall encouraging that we've come down from that horrible peak back in the spring to now where we are at, again, a relatively low level, even with some days where we have 0 deaths reported, but not that sustained level of no cases, no hospitalizations, no deaths. So again, our goal is to get to 0, and the outbreak, like with any outbreak, it's not considered over until we go 2 incubation periods with no new reported cases. So as you'll recall, the incubation period with COVID-19 is 2 to 14 days. So if we take 14 days times 2, that's 28 days. So really our what we're striving toward is to get to, first to lower our rates and then to get to 28 days with no new reported cases before we can consider that we've actually got a handle, that we're able to manage this. And we would still anticipate, some ongoing sporadic activity, but at least if it's very contained, then we can still, address that promptly so that it doesn't get then, resurge to the ongoing widespread activity that we're experiencing currently. So that's our severe outcomes. And then if we could please go, let's look at our age graphs over time. These are some graphs that were just added recently. So we have our cases over time broken out by age group. And this one has our youth age groups. So you'll see here, our increase in our recent activity is really driven by our 15 to 19-year-olds. We've all been hearing and seeing, increased gatherings, no masking, and just not following the recommendations that we really need them to. So we all need to model and promote those measures. And the 0 to 4-year-olds are at the lowest level of activity. And then the 5 to 14-year-olds are just above them, but it's really that 15 to 19-year-old age group that's, at a really concerningly high level of activity. And so moving forward, then we have another graph that was added that covers all age groups with 20-year breakpoints. So we've got our 0 to 19-year-olds reflected here in the red line, with the age group with the highest case counts in recent days and weeks are the 20 to 39-year-olds. So our activity recently has really been driven by our youth and our young adults. And then the next age group that we're seeing is the 40 to 59-year-olds in the yellow line there, and then followed by the 60 to 79, and then and it's actually interesting if you see the purple line there of our elderly population that still is disproportionately impacted, but they did have increased activity in the earlier part of our experience with COVID-19, and thankfully, at least that's come down. But unfortunately, they are always at risk as long as there are high levels of virus being transmitted through the community, because it might take longer to get to them, but as long as it's circulating in the community, then there's always risk of it being transmitted with more severe outcomes experienced by our elderly and other vulnerable populations. So just wanted to walk through those graphs, and we can pause, and then please at your leisure, you can kind of poke around and see if you have any questions. We continue to have our municipality data in the center there, and the Dayton City Selector at the top right that we reviewed last time, I believe. So at that point, I'll pause and turn it back over to Karen. Thank you. Thanks, Adam.
Thanks. Any questions?
I have a question for Rashmi. Sorry. So do you talk to superintendents, Rashmi? I know you talk to the mayors, but do you talk to superintendents of schools on a weekly, monthly basis, or what's the communication?
Karen, would you like to talk about that?
Yeah, we talk with them. We talk with them a whole lot. We talk with them twice a week. On
Twice a week.
Mondays, yeah, Mondays at 2 and Fridays at noon. So yes.
And what have you been advising the high schools then? Because I work in Elmhurst. I was there today, and I heard my patient moms telling me that York might be going to hybrid next week. And, I hear I see rallies going on, and tonight was at the Yorks, and
Sure.
earlier this week there was one in Wheaton. So what's the message that you're sending out right now to high schools, especially?
Absolutely. And Adam, if you could go back to the dashboard, I think that's the easiest way to pull up our metrics. So first off, to clarify, that the guidance that we provide to school districts is just that. It is recommendations.
Okay.
And so certainly the work that they do and the judgment that the superintendents have of what's best for their community should always be weighted with that. But what we've established is a return to school framework. And again, we reference this just in passing, but we identified that there's a spectrum of responses. We very strongly support kids getting back in school. We absolutely agree with everyone that that's where they need to be. That's where they access a lot of their services. That's where they maintain their peer support and all of that. So our goal really should be on getting kids back to school. That said, however, what happens in school as far as transmission goes, is impacted by what happens outside of school. Until we get our community transmission under control, we are jeopardizing and we're really hurting our kids' ability to be successful in school. Right now, we are in the moderate community transmission phase. So we are encouraging the hybrid model with some to no mixing of groups of students, that some students will be able to do virtual just fine, whereas others will need to participate in school with that kind of structure. And that is because we're in that phase because of these elements listed under the first row. We have, yes, thank you. Because our metrics show that we have any one of these, we have transitioned to orange once in the last 4 weeks. We are solidly in this moderate community transmission phase because our county case rates have been way above 50 for a very long time. They're not to 100 yet, but they have been over 90 on a couple of weeks, and that's very concerning. We also have not seen the overall case numbers increase to the levels that would put us into a more controlled setting, a more virtual setting, and our test positivity is reaching 5%, but not there yet. So what we talked to superintendents about is the fact that as we're moving up with our response, which is where we're at right now, you only have to meet one of the metrics that's listed in the different columns in order to be in that particular area. So it's not that you have to meet 3 of 5 or 2 of 3. It's any one will put you in that category. So that's where we're at right now. But the other key with this is that we're recommending that all IDPH and ISB health and safety precautions are also in place, and many schools have been determining that those are challenging, if not impossible, for them to adhere to, and so they're making some schools are making the determination to step back from hybrid and go to only virtual. I will say that we have a number of school districts that are doing hybrid and have really worked with not only their families, but the staff, the teachers. And I'm quite excited to see those kids being able to get back to school. Rashmi, anything to add?
No, thank you. I was just gonna drop the link to our schools page in case anyone would like to reference the framework and our weekly metrics that are updated and posted there as well. Thank you. Thought you summarized everything perfectly.
Lanny Wilson here, Karen and Rashmi, I just want to give a shout out from the DuPage Health Coalition earlier today where I presented this in a very brief form, but they were so wowed by it. So congratulations to your team who's putting this together. As the meeting was finishing, Kevin Most, the president of the DuPage Health Coalition, said, everybody's going to get off of this board meeting and go directly to their computers, pull up that dashboard and look at the information on it. So it's very well done.
Thank you. Thanks.
Thank you. And
We
thanks
do,
to our
and-
GIS partners too.
Yes, absolutely. And Adam, you were just with the metrics that we release on a weekly basis. Could you pull that form back up?
Karen, I have a question when you get to it.
Sure. So these are the metrics. This is for last week. It is based on the week's data from the prior week. And so these are the metrics. The left column is the metrics that we're using. The next column has to do with what we're looking, where we're standing with those metrics. The third column clearly is the trend if we're going in a positive direction, or the orange arrow speaks to the fact that we're heading in the wrong direction. and then where it sits, how many of these metrics are in what category of community transmission. The other thing that I will point out, and Mindy, I apologize, on the framework sheet is we did come up with these, we developed these metrics both based on what IDPH was recommending, but then we also used a variety of resources from across the country, and all of those are linked at the bottom. So if you're interested in how we develop these, each of these sources are hyperlinked at the bottom of this framework. Mindy, sorry.
Oh, that's okay. So I guess my question is at some point we went from flattening the curve to now we need no cases. So I'm a little confused where that change happened, and I'm not sure everybody knows that either, because I work in healthcare and I don't know when we
Right.
went to flatten the curve. The hospital cases are like 10 or below at major hospitals by us in our county. We're not seeing the hospitalization. So I'm trying to find out where this change occurred. We're never going to get to zero. I mean, it's not going to happen. We've never gotten rid of the flu. We've never gotten rid of, I just don't
Right.
understand where this change in mindset happened. If you could maybe help us understand that a little bit.
Rashmi, would you like to take that?
Sure. Yeah. And it's not really a change. It is kind of aspirational, but it's just relative to outbreak level activity versus endemic level, ongoing low level of activity. But I mean, yeah, you're right. With influenza, we experience a pandemic every year, but thankfully, at least it's not a novel strain typically. I mean, we certainly did during 2009, 2010 with H1N1, but with coronavirus being a novel virus, and until we have a vaccine and or an FDA approved treatment, we will continue to, see these waves of increased activity. So it's not a change. You're right. I mean, our goal initially was containment and flattening the curve, as you said. And then as it's, we've had widespread transmission at fluctuating levels, then we've transitioned to ongoing containment efforts where we want cases to self-isolate and contacts to self-quarantine. But then we do need community level participation in these prevention measures while we still try to maintain some level of reopening and maintaining activities and services as best as we can without, as safely as possible. Nothing's 100% safe. We just want to have a layered approach to risk reduction. And then, I can't anticipate when we get to zero, but it's certainly aspirational. And there are countries and states, even in the US, that have either been at zero or have had some, prolonged period, very different from Illinois, of course, not with the population density that we have. So we have our own unique circumstances, but it is really aspirational. I certainly don't think, there's so much we can do to help bring it down that I don't think we would want to resign ourselves to the high level of activity that we have right now, just knowing that at least we are seeing increased activity here, but as you mentioned, thankfully not seeing the severe outcomes to the extent we were in the spring, but may we never see that again, because as we've said, there's no condition for which we can remember having in excess of 500 deaths in 6 months in DuPage County, probably for decades. So it's really more aspirational and just what we want to be working toward at the individual, family level and community level. Does that help?
It does. Thank you.
Thank you.
Yeah, I also think as a person who tends to like pictures to tell stories, I also think that what we're looking at is maybe not zero cases or zero activity, but certainly being able to maintain a low level activity versus having this wave again, going up, an increasing number of cases. So I think that's flattening the curve too. It's like, yeah, we wanted it to plateau and go down, but then the idea is in my mind, is to have it stay low level. And you know, part of this is about priorities, right? And some of you have shared stories and articles that you've read with me, and I very much appreciate that about, you know, if it's really our priority to get kids in schools, then maybe bars and tattoo parlors and some of these other businesses don't need to be open. And so it has to do with containing the spread of the disease versus and priorities. Because what we're seeing is we don't have large level outbreaks. We don't have big clusters happening. They're happening across our community with people not letting their guard down. They are letting their guard down and, you know, thinking, well, if it's family, it's okay. You know, or if it's people I know, they can't be infected, when in fact, we still see 30 to 50% of people who are positive, who are asymptomatic. So yeah, multiple levels of this challenge. The other is that we still don't have a valid or recognized treatment for this disease. And so, you know, those are all concerns that kind of play into it. I think flattening the curve was something that we could all get around. But as Dr. Tube pointed out, it's not quite a straight line.
This is Lori. I guess my question for a moment is, you know, the right graph to be looking at. Is it cases or is it hospitalizations? I mean, I guess I understand cases are a metric, hospitalizations are a metric, deaths are a metric. And I feel like we're so focused on cases that could be asymptomatic. Why are we not more focused on severity instead as the key metric?
I think there's a couple of reasons, and I'll start, and then Rashmi, please join in. Part of the story with this is we see hospitalizations being reduced, certainly, but I don't think the only lesson that we can take from this graph is that it is less acute illness happening. I think in the early stages, we didn't know what was going on with the disease progression, and so hospitals were keeping people perhaps for weeks, and now people are being hospitalized for days. We also have created resources for people to monitor themselves at home. So it's not that people aren't getting as sick as they were. It's that our medical care has caught up a bit with the hospitalizations. The other is, we know that 5 to 19-year-olds tend to not get as sick initially, but as those cases spread, so if the 7-year-old comes home, they're completely asymptomatic, but mom or dad has to work. So they go to grandpa and grandma's house, or they go to auntie's house or whatever. Auntie has an underlying condition, and then that person is hospitalized. So it may take, we've always talked about hospitals as being, hospitalizations and death as being lagging indicators, but depending on where the disease activity is happening initially, it may be even longer of a lag time till we see these hospitalizations increase. There's just, Cranes just had a headline saying that, you know, our positivity is going down as a state. However, our hospitalization, to Rashmi's point, continues to stay steady or increase. Luckily, we're not seeing that at the levels that happened in April and May. But again, we are seeing that, we're hearing that from our hospital and healthcare partners as well, is that, yeah, at some hospitals, the levels are going down, but at others, they're staying pretty high and sustained.
Questions of Rashmi or Karen, or comments from any of the board members? Okay, a couple of observations before we move on. If you hadn't seen the dashboard before, this is shared every Monday with the mayors and managers, and their response is the same as Lanny's response he got from the DuPage Health Coalition. It not only is extremely well presented, but it carries a significant amount of information that helps us see where we're at from time to time. The two questions that I get the most, obviously, is about schools. I see people every day, being in court every day, and being an elected official, constantly asking me questions. I think it's important for any of us to be able to answer, why aren't kids back in school and what are we doing about it? That it really isn't our decision. The health department's never told the superintendent, don't open a school. We make the recommendations. And one of the things that I believe drives the superintendents, and why maybe some of the private schools are having in-person education and not the public schools, is the teachers and the teachers' unions, who have indicated an unwillingness to go back to school. And maybe rightfully so. They don't want to subject themselves or their children to what they may or may not get. And I think that's certainly something that the superintendents of the public institutions have to take into consideration. The other question that I get, and I hesitate to ask it because we could probably talk about it for 4 hours and then no one wants to be here, but I hear it consistently by either the deniers or people who have legitimate questions, and that is, and Rashmi, this can probably for you, that many of the deaths that are attributed to COVID-19 are people who would have died anyhow, or people who had died from another condition, or they hear these urban legends that someone goes to a hospital and they die, and you know the medical examiner or whomever doesn't know what the cause of death is, so they mark down COVID, and that's why the numbers are what they are. Other than rolling my eyes at something like that, I really don't know how to respond to it. So perhaps you can enlighten me, if not the rest of the board, on how that managed to become a cause of concern for some people, and where they get that information, and whether there's any legitimacy to it at all.
Sure. Yeah, there is. I mean, as we know, there's a lot of misinformation circulating, and it's all we can do is to provide the most accurate current information that we have. And there are some good summaries from CDC and others on excess mortality that's been observed during this time, with some pretty impressive graphs where, for example, when we were at around 180,000, now we're nationally just shy of 190,000. But when we were at 180,000 deaths, there's a curve that shows the overall deaths during this time. And I know it was over 200,000. It may have been even 220,000. So I'll try to find it to confirm. But there were these several thousand deaths that are just not specifically accounted for above and beyond the COVID-19 identified related deaths. And there are specific criteria. They've evolved a bit, but there are specific criteria now for a death that's deemed to be COVID-19 related to meet those criteria. It's not arbitrary. It's not by speculation. It's typically with a lab confirmation, but also it needs to be either at the public health case classification level or through the postmortem and on the death certificate. So there has to be some indication that COVID-19 was at least the primary cause or an underlying cause, or played some contributing factor to this individual's death for it to be counted. It's not speculative or anything like that. And like I said, if anything, when you look at that that curve of excess mortality, it there's thought that even with the current case classification, we're not necessarily capturing all of them, which is okay because we don't want to overcount. We want to be accurate, but then still potentially, at least qualify or understand what the overall curve represents, because the ones that are in that increasing curve of excess mortality that are not identified as COVID could represent someone who, say, had chest pain, was otherwise asymptomatic and had COVID-19, but wasn't identified, but also may have had some underlying symptoms that didn't trigger testing. And so they were undetected essentially. And that death, for example, would not be counted as a COVID-19 related death. So I mean, I guess it's hard to necessarily change anyone's mind, but we can find a little bit of simple explanation that can help explain that a little bit better.
I agree with you. It is difficult to change someone's mind. One more question. A lot of what the angst, I think, in the schools is kids who want to play sports.
Mm-hmm.
And that seems to be a motivating factor to get kids back into school as much as the actual learning in some cases. And I know that for a while, I heard a few weeks ago that myocarditis, I believe, was a concern with athletes, young people who may have COVID and then have this heart problem that would last with them the rest of their lives. And that was one of the reasons that that sports wasn't opened back up again in the Illinois High School Association. So again, the questions that I get, I'm sure Bob gets it, many of us get it, is that how come, the kids are playing Friday Night Lights high school football in Indiana and Wisconsin, and I turned on the TV last Saturday and I watched a couple of college football games, and there's a pro football game tonight. The NFL season is opening up. Are we in Illinois just ahead of the curve? Are we overreacting to it? And is myocarditis, I heard a lot about it a few weeks ago, and it seems to have kind of not been out there in the forefront the last week or so. Is that for a particular reason?
I think it's a good question. And I haven't seen any specific, it's certainly been observed and being reported. And I think they're probably trying to figure out how to track and monitor and classify it so that we can gather and analyze data and outcomes, and then hopefully identify how it can either be prevented or have more severe complications prevented. Or, as I think the question was appropriately raised, see if kids who have evidence of myocarditis, then, do they need to have medical clearance before resuming sports? And when is it considered safe or safer for them to resume sports? So I think, I'll certainly see what I can find. I haven't seen any clear guidance on that yet, other than the reports of observing cases of myocarditis in younger individuals. But the sports athletic teams and all, like, we've gotten several reports of individual cases and even a couple of outbreaks related to athletic team participation and membership, and that's when we can identify the close contact within that team. But as we know, sometimes the close contact occurs outside of that team, but among team members, where there's, not just the team-based activity, but then socializing or, other gatherings and all before or after. So it does bring, there are certainly many rewards and benefits associated with it, and there are some sports where they are able to maintain physical distance while participating. But for example, like, there are cross-country teams where you could run 6 feet apart, but they tend to kind of hover and run together just kind of for the social interaction of it. So if and when they can practice and participate in a more safe way, that'll help reduce the risk of transmission. So I think everyone is still learning to navigate, and there's still so much that we don't know, just given the high risk of complications, particularly in persons with underlying conditions, and whether they're, young, or certainly there's an increased incidence of underlying conditions the older we get. So still a lot of unknown, but and it's just walking that fine balance of living our lives without losing our lives. So yeah, all great questions, and I'll certainly try to find what I can and report back.
Thank you. Thank you. Any other questions of Rashmi or Karen? And thank you all, and Chris and Adam and everybody who's done a remarkable job keeping us informed and keeping us healthy. Thank you so much. Okay, that concludes the public health update. We'll move on to approval of the minutes. I'll entertain a motion to approve the minutes of August 13th, 2020.
So moved.
Second.
Motion by Dr. Wilson and a second by, who was that? Sorry.
Robert Spinoni.
Okay, from Mr. Spadoni. Any additions, corrections, or deletions to the minutes? Hearing none, seeing none. Roll call, please. Penny?
Sorry, Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Dr. Hussein,
Yes.
Mr. Larson, Mr.
Yeah.
Larson,
Aye.
Dr. Munir,
Yes.
Dr. Scouten,
Yes.
Mr. Spadoni,
Yes.
President Tornatore,
Aye.
Dr. Weeks.
Aye.
Mr. President, the motion passes.
Thank you. The minutes are approved. Moving on to the treasurer's report. Mike, did you want to take this?
Yes, thank you, President
Please.
Tornatore. As of July 1st, the Health Department General Fund balance totaled $29,616,137. Receipts for the month totaled $4,577,172.53, and disbursements totaled $4,462,620.08, leaving a month-end total in the Health Department General Fund of $29,730,689.45. Combined balances in all four health department funds as of July 1st totaled $38,795,042.27. Combined receipts for the month totaled $4,724,514.21, and combined disbursements totaled $5,061,468.99, leaving the combined balances in all four health department funds at $38,458,087.49. Investments earnings recorded to the general ledger in the month of July for all four health department funds totaled $7,451.37. Including the July earnings year-to-date, investment earnings in all four funds have totaled $213,159.62. Any questions?
Any questions of Mike regarding the treasurer's report? Okay, I'll entertain a motion to approve the treasurer's report.
Motion to approve.
Motion, is there a second?
Second.
Roll
Robert.
call, please, Penny.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Dr. Hussein,
Yes.
Mr. Larson,
Aye.
Dr. Munir,
Yes.
Dr. Scouten,
Yes.
Mr. Spadoni,
Yes.
President Tornatore,
Aye.
Dr. Weeks.
Aye.
Mr. President, the motion passes.
Thank you. And the treasurer's report is approved. Moving on to consent items, I'll entertain a motion to approve the one item under personnel transactions.
Moved.
Second.
The motion and a second. Any questions, comments, discussion on that item? Okay, there being none, hearing none, all those in favor signify by saying aye.
Aye.
Any opposed? And the motion carries. Moving on to action items. The 2020 revised holiday calendar, you notice, includes now an additional holiday, that being Election Day, November 3rd. That has been deemed a state holiday, so we had to amend the holiday calendar. I'll entertain a motion to approve the revised amended holiday calendar for 2020.
So
So
moved.
moved.
There's a motion by Mr. Spadoni, a second by member Larson. All is in favor, signify by saying aye.
Aye.
Any opposed? And the calendar is approved. Moving on to grant acceptances, unless there's any opposition, I'll entertain a motion to combine and approve items 2A, B, and C. This is the breastfeeding peer counseling grant amendment in the amount of $20,000, Health Families Illinois Program grant amendment for $3,677, and the United States FDA Environmental Health Data System grant in the amount of $70,000. There a motion to approve those and combine them.
So moved.
Motion by
Second.
member Larson,
Second.
second by member
Benoni.
Spadoni. Any questions, comments? Roll call, please, Penny.
Mr. Larson,
Aye.
Dr. Manier,
Yes.
Dr. Scouten,
yes,
Mr. Spadoni,
Yes.
President Tornatore,
Aye.
Dr. Weeks. Dr. Weeks. Yep. Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Dr. Hussein.
Yes.
Mr. President, the motion passes.
Thank you. And the grant acceptances are approved. Moving on to procurement, unless there's any opposition, I'll entertain a motion to approve items 3A through L. These are procurement issues of various kinds.
Motion to combine and approve.
Motion by Dr. Wilson to combine and approve. Is there a second?
I'll second.
Second by member Larson. Any questions, comments, discussion regarding these?
Only there's
Moving
a
on.
slight typo in the second one, but it says the funds are budged instead of budgeted.
I'm sorry, where were you, Bob?
And in the second one, it says the funds are budged. I don't know where they're being budged from, but
Oh, budget. Okay. Well, we'll add the E and the T to that. Okay. Okay. Any other questions, comments on any of these? Hearing none, seeing none. Roll call, please, Penny.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Dr. Hussein,
Yes.
Mr. Larson,
aye.
Dr. Manier,
Yes.
Dr. Scouten,
yes,
Mr. Spadoni,
Yes.
President Tornatore,
Aye.
Dr. Weeks.
Aye.
Mr. President, the motion passes.
Thank you. And the motion carries. Moving on to unfinished business. Does anyone have any unfinished business for the board this evening? Okay, I did want to have Karen bring us up to speed, if she could, on one item. I think it's appropriate to discuss, that being the potential issue of some property in Addison that we were talking about last month. Karen, without divulging anything that we discussed in executive session, do you have anything for the board? An update, if you
Sure,
will.
we did. I just, only an update that we did meet with potential sellers. We, being Dennis and myself, had a conference call with the potential sellers and indicated that we had received a no from the Board of Health. However, we provided them with the caveat that it was a no, now is not the right time. And if the property was still available and was still something that we were interested in, we would pursue back with them in 3 to 4 months. Of course, they were disappointed. However, it was a fine conversation. And we acknowledge that if they were able to find purchasers for that property in between now and if we were to circle back, we would absolutely understand as well. So we shared that information with them per the board's direction. And I don't know, Dennis, if you have anything more to add.
Apparently doesn't. Yeah, Dennis doesn't have anything more to add. So that's good. Okay, thank you for that update.
Yes.
Any new business before the board? Any member of the board have anything new that they wish to bring to the table? Seeing none, hearing none. Our next meeting will be October 8th. I was certainly hoping we could be seeing each other in person by that date, but it doesn't look like that's going to happen, but who knows? But our next meeting in any event will be on October 8th. If there's no further business, I'll entertain a motion to adjourn.
So moved. Second.
Motion by member Larson, second by Dr. Wilson. All those in favor?
Aye.
Aye.
Any opposed? We are adjourned. Stay healthy, everyone. Good to see you.
Thank you. Have a good evening.
Thanks
Take
so
care.
much.
You too, Sam.
Good evening.
Everyone.
Job.